on top of the turkey with aluminum foil, keeps all the moisture in. Never worked. Turkey was always dry anyway. But then my grandmother didn't really take the complainers. Somebody would say, oh, turkey's dry. That's why you have gravy. It's like a lubricant for dry turkey. Turkeys are dry. I'm not making a turkey anyway. Numbers today. Positivity in the, what we call the microcluster zones, yellow, orange, red. 5.2 statewide without the positivity, without the microcluster zones is about 3. Overall, positivity with those zones, 3.6. We did 173,000 tests. What does that mean? We do more tests than any state in the nation, more tests pro rata than any state in the nation. So we just have more data to make decisions on. And that's a welcome relief. You know, everybody has an opinion on COVID. We have facts that we deal with on COVID. And that's the way to make decisions based on facts. 41 people passed away. That number has been going up steadily again in this new phase. And they're in our thoughts and prayers. Statewide hospitalizations has been going up steadily. It's up 126, 2,900. Number of people in ICU beds, number of intubations up. We know what this means, right? The positivity rate goes up. That means you're going to see the hospitalization rate go up. That means you're going to see the intensive care unit number go up. That means you're going to see the intubation number go up. That means you're going to see the death rate number go up. That is the progression. People get COVID, they're home for a few days, they get worse, they go to the hospital, they go to the ICU, they're intubated, and they pass away. So we know what these numbers mean. We've been here, we've seen this movie. Why do healthcare officials say that we're now in a dangerous period with Thanksgiving? Because two things. One, the COVID rates are already increasing. You saw it increase today. You've been seeing it increase over the past few weeks. Now, we said the COVID rate would increase over the fall because that's what was diagnosed. All the experts said you get into the fall, what you're going to see is the weather gets colder, college students are going to be coming home, and college students will be coming home from other states. They'll be bringing the disease with them. There'll be fewer outdoor gatherings because it's cold. So people are going to be coming inside, and the COVID rate will be going up. They diagnosed that for the fall. And that is exactly what we're seeing. We have tremendous increases statewide here in Rochester, in Monroe County, that have been going up through the fall. We expected it, we knew it. We now have an added problem that we run into Thanksgiving. Thanksgiving will be an added accelerant. Why? People travel, more social activity. The more social activity, the more the infection rate goes up. We know that. What was the point of the close down? The point of the close down was reduce the social activity, reduce the spread. What's the inverse of the close down? Thanksgiving holiday. I'm going home to see my family. And that's exactly what has been happening. The travel is way up. The hospitals report, the airports are reporting travel that is way up. And we're going to see an increase post-Thanksgiving. We expect that. That is going to take a bad situation and make it worse because the numbers were already going up. We then have increased Thanksgiving travel. That's going to be an additional accelerant. Those numbers are going to go up again. Those are the facts of where we are. How much do the numbers go up over Thanksgiving? Nobody knows. It depends on how people perform. If you look at the facts we know, the increase in air travel, we expect there will be a significant rise. When do you see it? You'll see it about 10 days after Thanksgiving. Again, you get the virus. There's a period where the virus is growing in your body, and it can be 7 to 10 days before you actually see the symptoms, you get sick, and you move to a hospital, and the hospitalization numbers go up. But we expect that. The global experts have all basically been recommending the same thing to us now. You have twice the death rate in the black community. So you have to recognize the mistake and the injustice, especially when it comes to the vaccine. If you're going to prioritize the vaccine, shouldn't you be prioritizing it for the communities that have the higher death rate? Majority of black zip codes, 67% more likely to have a shortage of primary care doctors. This is a social justice and racial justice and economic justice issue. The NAACP, any introduction of a vaccine plan devoid of the infrastructure we know is effective within the black community reinforces the same incompetence that has affected so many thus far. Urban League, Mayor Mark Morial. The current administration's plan is thoughtless, careless, and needs to be taken back to the drawing board. So, this vaccine is not tomorrow and is not as easy as we think, and it has to be done fairly and equitably. And it has to correct for the mistakes that we have made so far. For today, the focus is Thanksgiving. There's a lot to be thankful for this year. We give thanks to the way New Yorkers have come together and the spirit of community that has managed this COVID illness. New Yorkers have done an incredible job. That's not rhetorical, that's on the facts. We had the highest infection rate in the United States of America. And now we have one of the lowest infection rates by the United States, in the United States of America. Who did that? Who took us from the highest rate to one of the lowest? New Yorkers did it. Because it's all about the behavior and the actions of New Yorkers. What New Yorkers do determines the infection rate in this state. Their actions, their discipline, their respect, that how New Yorkers act tell you the infection rate next week. It's a pure function of social responsibility. We talk about community action, social action. This is it. What a community does is the infection rate in that community. And New Yorkers have done an incredible job. You look at where we are today. New York has an infection rate of about 2.9%. The only states with a lower infection rate, Vermont, Hawaii, and Maine. Now, Vermont, Hawaii, and Maine, beautiful states. I've been to all three. Less density, less urban, fewer cities. After us, the entire United States, it has a higher rate. The entire United States has a higher rate. Wyoming, 57%. South Dakota, 43%. And by the way, that's without the density of New York. And that's without the fact that we were at 50% at our height. They are now higher than we were at our height. How incredible is that? And that's all because New Yorkers are smart. And we gave them the information and they acted intelligently. Added issue, Thanksgiving travel. If anyone's coming from another state into New York, they're coming from a higher infection rate place. And they pose, by definition, more of a threat. Connecticut is at 5.4%. Massachusetts, 2.97%. Delaware, 5.2%. New Jersey has a higher percentage than we do. So all the surrounding states are higher than we are. But I give thanks for the intelligence and the action of New Yorkers. This Thanksgiving, though, we have to stay smart. We can't let our guard down. We have to work together to keep the infection rate down through the Thanksgiving holiday. And, well, I can be smart. I know what I have to look out for. Oh, really? 24%, according to the CDC, people who gave COVID to someone else never had symptoms. You don't have to have symptoms. It's not like you're going to walk into a person who's sneezing and coughing and is obviously sick. 24% never develops symptoms. 35% of the transmission is from pre-symptomatic, which means you had COVID, you had no symptoms. I'm going to be with my family. My family's safe. My family would never infect me. They don't have to know. It's not that they have to be malicious or reckless. My brother would never do that to me. My sister would never do that to me. They don't have to know. They don't have a symptom. That's why this disease is so insidious. 35% never had a symptom, but yet they're going to spread the disease. You can't just assume because you have no symptoms that you're safe. That's why the advice here in New York, no more than 10 people, celebrate, but celebrate with your household, meaning the people who you have had in your household. Not invite over Uncle John, Aunt Nancy, Aunt Marie, they're part of my household. No, your household is who you are currently living with. And this is not a political issue. Today, this nation is so divided, more divided than it's ever been. And it's so divided politically. Everything is a political division, every issue. This is now a political symbol. How did this become a political symbol? Well, if you're a Democrat, you wear this. If you're a Republican, you don't wear this. If you're a Democrat, you support this. If you're a Republican, you don't support this. This is about public health. I don't care about your politics. I really don't care about your politics. And you don't care about mine. I care about your health. I care about if we're overwhelming our hospital system. I care about how many people die. That's what I care about. Forget the politics. It's over. The election's over. And even through the political lens, CDC is Donald Trump's administration. Donald Trump's CDC says, celebrate only with your household. That's Donald Trump. Joe Biden's COVID advisors say the exact same thing. So even if you're in this political mindset, I can't trust the other side, I can't trust Democrats, I can't trust Republicans, they both agree on this issue. Celebrate only with your household. They both agree. So even in this hyper-political moment, this is the one thing both sides agree on. And by the way, can you name one other thing that Donald Trump and Joe Biden agree on? One other thing? I can't. They both agree on this advice. So this is not a political fight. It's the one thing everybody agrees on. And the one thing everybody agrees on is this is not a normal Thanksgiving. Well, on Thanksgiving, my Uncle Joe always comes over. Yeah, I understand that. This is not a normal Thanksgiving. It wasn't a normal Labor Day. It wasn't a normal Memorial Day. It's not a normal summer. It's not a normal anything. This is not a normal Thanksgiving. And to act like it's a normal Thanksgiving is to deny reality. Of every health expert in the nation, Democrat or Republican, well, I know better. Well, then you know better than every public health expert on both sides of the aisle in the United States of America. So I don't know what to tell you, but I think that this is not a normal Thanksgiving. I think it's a special Thanksgiving. And rather than the commercialized Thanksgiving, let's think about a spiritualized Thanksgiving. And let's think about what Thanksgiving really means as a matter of principle. We have a lot to be thankful for. I mentioned the National Guard. We have a lot to be thankful for the people who we lost during COVID. The essential workers who showed up to keep us safe, who left their homes so everyone else could stay in the safety of their home. The bus drivers who showed up, the doctors who showed up, the nurses who showed up, the utility workers who showed up, many of whom died so other people could stay home. Think of how many thousands of families are celebrating Thanksgiving without a loved one this year. There are tens of thousands of families celebrating without a loved one. People who gave their life during COVID to help others. That's something to be thankful for. And remember the less fortunate. Everyone has to do their part. That's why we have this very attractive and pithy fashion statement mask that I know you are all jealous of. I can see it on your face. Don't be a turkey. Wear a mask. You know, New Yorkers, we cut to the chase. We say it as it is. Don't be a turkey. Wear a mask this Thanksgiving. Be smart. Let's get past this. Let's get through the winter. Get the vaccination done. And then the end is in sight. But we're not there yet. They say run through the tape. We have to finish it. Get through Thanksgiving. Get through the holiday season. Get through the winter. Get vaccinated. And then we'll get on with life. Don't be a turkey. Questions?
Governor, the health commissioner here in Monroe County has said that they have not contact traced a single case of COVID-19 back to a gym, a hair salon, or a barber shop. Yet today, as we go into the orange zone right here, those are the people most impacted by the new restrictions. I asked you about this on a phone call last week, and you pointed to national statistics. But I guess the understanding of the micro-cluster zones was to drill down locally into what's causing the spread. If that is not causing the spread, why are these people the most impacted?
I don't know what the local health department, well, let me do it the other way. Where do they say this spread is coming from?
What you said, living room spread, small group gatherings in private homes.
Yeah. Well, every expert says the same thing. Every expert, every state, right? Democratic states, Republican states, big states, small states, Democratic experts, Republican experts. The highest rates of spread are gyms, restaurants, bars, gyms, home gatherings. The situation where you actually have the least control is home gatherings. CDC says only your household. How would you ever enforce that? I don't know. That's Donald Trump. Joe Biden says celebrate only with your household. We have a rule no more than 10. That is very, very hard to enforce. Bars, restaurants, gyms, you can enforce. Those are the four main spreaders. So what you do what you can with those four main spreaders. If that is true, what the Monroe Health Department says, that is a national anomaly. I can tell you that. Do you know, either of you guys know more than that?
I don't know what the Monroe County Health Department said specifically, but remember the approach. It's about the high-risk activities, the low-risk activities. When you're in a beauty salon getting your nails done, if you're getting your hair cut, you, by definition, can't be socially distanced. You're indoors where the air circulation isn't as great. You're in closer proximity to one another. Same thing in gyms. Obviously, when people are working out, they're breathing much more heavily. People are on machines. Hopefully, they should be socially distanced if they are following the protocols, but it's not all instances you are. And the issue is you're trying to decrease the rate of spread. When you're seeing these, when you're hitting these percentages, there's a greater chance of community spread. And so what you're trying to do is you're trying to address, as the governor said, businesses that are higher risk, that are known to cause spread of infection, because you don't necessarily know every single contact trace, every single source of infection. So those are three areas that we know from the duration of COVID that has spread. And so what you're trying to do is to stop the community spread and lower the chance that you're going to continue to cause spread. So you are closing businesses where there's a greater chance of spread by virtue of the closeness of the people that are working with one another, that are doing in-person services, or again, like in gyms where if you're breathing more heavily, you're closer in contact with one another.
Inside your restrictions, they follow the restrictions that you put in place for them to reopen, which would have alleviated some of what you're talking about.
The restrictions are great, and we saw at moments through this for months and months and months that the restrictions have worked. But what you're seeing in these areas with these spikes is that there's a greater prevalence of community spread. And so when there's a greater prevalence of community spread, yes, these things are helpful, but they're not bulletproof.
Governor, I want to ask you about Erie County. You said microcluster zones work in Erie County. The positivity rate has started to level off, but it certainly hasn't gone down since the microcluster zone was put into place there. Is it working in Erie County in your eyes? What's happening there?
Well, a leveling off, when the line is going like this, and then the line changes and levels off, that is working. You're right, you'd love to see up, level, down, but level is working, right? Because that was an arrow headed straight up.
So at what point do you indicated a couple days ago that Buffalo is very close to becoming a threat. We didn't get that announcement today, but what are you looking for?
Well, we're watching the numbers. We're going to watch through this Thanksgiving season. This is where I think if we're going to get into trouble, you're going to see it a few days, 7 days after this Thanksgiving weekend. You'll start to feel the number. We're also going to be doing, we've been advised to do now a winter plan, which adds factors to the yellow, orange, red, primarily hospitalization rate. We have to prioritize hospital beds. We have to make sure we don't overwhelm hospitals, and we don't go back into the emergency field hospitals. So we're going to watch the numbers over Thanksgiving. We're going to add in factors in the yellow, orange, red zones, primarily hospitalization rate, and prioritize those zones that are generating the highest hospitalization rate. And then we'll have announcements. The great fear is two things: overwhelm the hospital system and people die. Those are you want to get to the bottom line fears. Those are the fears. Overwhelm the hospital system, people die. Just going back to Monroe for a second. You had 75 people hospitalized November 4th. You went to 268. That's a 257% increase. It's one of the highest increases in the state of New York. What happened? And if they knew what was causing it, why didn't they stop it?
Well, like you said, it'd be difficult to enforce the 10-person.
So they're saying the 257% increase all came from small gatherings?
I'm just telling you, the health commissioner said that he has not contact traced one case back to a gym,
Yeah.
hair salon, or barber.
Well, then I would say to the health commissioner, you have a 257% increase. Obviously, you haven't figured out what's causing it, and if you have, you haven't stopped it. But if that continues, you will overwhelm the hospital system in a matter of weeks.
I have another question regarding microclusters. So we have some businesses going into Orange today. We've seen a situation where there could be a business in Orange on one side of the street, a business in Yellow on the other side. And you said microclusters work. Some people are wondering, are they as effective upstate as they are downstate? And it's so easy to go between the zones.
It's just as easy downstate. There's no difference. Downstate you also have across the street because you have to draw the line somewhere, right? And wherever you draw the line, there's always going to be somebody on the other side of the street. That is an unavoidable situation. I mean, just think about it. You're focusing and defining a zone. You have to draw a line around the street. And yeah, then there's always somebody on the other side of the street or one block away. That is an unavoidable consequence.
I mean, in New York City, it's actually worse, right? Because in New York City, like literally, it's drawn on a street, and you're in an area where everyone's walking, and it's even more dense.
And I would add as well, we've seen in upstate, Broome County is a good example, and other places where zones have been implemented, and you've seen positivity, new cases per capita, daily hospital admissions reduced in a significant way. So this is both the restrictions, it's also a message to the community that you have a serious issue here in your community, and if action is not taken, the restrictions will get tighter because we have to. As the governor said, it's about the hospital system, it's about saving lives, and if we don't take this action now, we know what's coming ahead. We know what the projections show is coming ahead.
Is there a concern though for people going into Orange just go across the street?
Of course, yeah, sure, they will. But the main point of the microcluster zone is this. Number one, the variance on the infection rate statewide is incredible. You can take one, even downstate, Manhattan, at one area, you have some neighborhoods that are at 0.6. You have some neighborhoods in Manhattan 5 times the infection rate. 2 miles away. The way your community acts makes a difference. And that's why the microcluster points that out. You on 152 Main Street, you have a 4% infection rate. This is not in the abstract. Monroe County, the city of Rochester. 152 Main Street, you have a problem. I live on 152 Main Street. Yeah, I know. It's your house is in that zone. Oh, I better be careful. I better be careful when I go to the store. I better be careful when I get on the bus. Yeah, you better be. So it brings it to a focus where people actually get it, and then you can improve it in your community. Once that attention goes up, you mean it's my neighborhood? Yeah, your neighborhood. Not her neighborhood, your neighborhood. That focus, that attention, because it's just your behavior. Okay, now you got my attention. I'm going to be more careful. And I think that's one of the reasons why you see it coming down, because it's just a sense of awareness. If you wear this thing, if you're careful, the number comes down. And that's what the microcluster does. It says, your house, your block. And I think not only does it affect your behavior, you talk to your household, you talk to your children, you talk to your neighbor, you hear that we have 4 times the rate. No, I didn't hear. You go to your grocery store, you say to your grocer, you're supposed to be keeping people apart. You go to the cleaners, you say, you're supposed to be keeping people apart. And we've seen zones, once they're aware it's them, because, people here in Monroe County, that's everybody else. That's not me. That's not my neighborhood. No, it's your neighborhood. And once people are aware of that, it changes their behavior. Also, we don't want to slow any businesses. We don't want to slow any hair salons. So if you know that it's one neighborhood, but it's not a neighborhood half a mile away, then don't restrict the businesses half a mile away. Only restrict the businesses in that area, which is better and smarter and fairer. Why didn't we do this before? Because remember, before it was the entire region. Because we have more data now. Before, we didn't have that kind of data. It was Buffalo, Rochester, Western New York was just, one region. We have done think about this, we've now done almost as many COVID tests as there are people in the state of New York. That's how many tests we've done. So we have a map with every COVID positive test. And you can look at that map and you can see right where they are. So what we say is when you see an intense cluster, that's a microcluster zone. And put a circle, not really a circle, whatever the shape of that cluster is, that's a zone. Don't affect the people half a mile away because they're fine. But tell those people in that area, you're not fine. Beware. Your neighbor may be infected. The kids your kids are playing with may be infected. And once they hear that, and they get that message, and they change their behavior, we've seen them drop. Not always, but sometimes.
More cluster zones will lead to more unemployment. A lot of these folks might only be eligible for $200 a week. How do they make ends meet?
Federal government has to pass a stimulus plan. You can't say to New Yorkers, or Virginians, or Texans, your choice is go to work and earn a check or die. That's not America. That's not America. You can't say your choice is the economy or public health.
Governor, can you clarify your comments recently that Western New York hasn't felt the full wrath of COVID? That offended a lot of people who have lost loved ones, have lost their jobs. Can you respond to those people?
My point was a simple and inarguable one. On the numbers, Western New York has not been hit as hard as downstate New York was. That is a fact. It's just a fact. Did we lose people in Buffalo? Yes. Did we lose as many people in Buffalo as a matter of percentage as we've lost in New York City? No. Was the problem much worse in New York City? Yes. Was it did people feel it more intensely in New York City because the numbers were so much higher? Yes. That's just on the numbers. On the numbers. New York City, you heard sirens all night long. New York City, you saw tractor trailers parked on the street, storing dead bodies. New York City, you saw them open up emergency cemeteries and digging holes in the ground to bury people. Just the numbers in New York City were higher. Thank God that didn't happen statewide. Thank God. And this has been tragic everywhere. It has been tragic everywhere. But thankfully, Buffalo was not hit as hard on as New York City. And I want to make sure it stays that way on the numbers. That's what that means. Have a happy Thanksgiving. You guys want to add anything?
Nope.
I'm going to give you this mask as a present. All the cool people are wearing this mask today. That's all I'm saying. I'm not saying you should wear it. I'm just saying, all the cool people are wearing, see?
I'm not.
Put on your cool turkey mask.
I like
See?
my mask.
Come
better.
on, there it is. Let's take a picture with the cool mask. Cool kids mask. Okay, guys, thank you. Happy Thanksgiving. Celebrate, but don't be a turkey.